Hi, my name is Liz, and today I'm going to talk about how mental health has been treated throughout history. The first insane asylum in America was built in 1773 in Williamsburg, Virginia. It was opened under the name Public Hospital for Persons of Insane and Disordered Minds and is now called Eastern State Hospital. It is still currently being run as a psychiatric hospital. Many lunatic asylums opened in the 19th century and grew quickly in population. The first mental hospitals used something called moral treatment rehabilitation, which meant they had patients work on farms and in kitchens and doing other such jobs in hopes the exposure to normal habits would help rehabilitate them. The moral treatment was meant for people with more acute cases, and doctors started to feel the need to implement new types of treatments. When psychiatrists felt the pressure to cure or find preventative techniques for mental illness, they began the practice of sterilizing certain patients in order to prevent the issues from reaching future generations. This practice was widely supported, and 33 states ended up adopting sterilization statutes requiring people to be sterilized if it was recommended by a board of experts. More than 65,000 mentally ill people ended up being sterilized. It wasn't until World War II, when there were revelations about Nazi war crimes, that people turned against these practices. After that, it became much less common, and the last surgical sterilization was performed in 1981 before being disbanded completely 2 years later. In the beginning of the 1900s, some doctors started to focus on ways to treat the patient's physical body instead of lifestyle or psyche treatments. One of the most famous treatments to emerge from this in the early 20th century was electroconvulsive therapy, also known as ECT or shock therapy. When ECT was first introduced, treatments involved high doses of electricity with no anesthesia, which caused more severe side effects. Memory loss was probably the most concerning side effect from this treatment. Other side effects included fear, confusion, anxiety, headaches, nausea, disorientation, and fogginess. Most people reported only experiencing these side effects for a short time after the treatment, and clinical data indicates ECT can actually reduce symptoms of severe depression, mania, and catatonia for long periods of time. In some rare cases, ECT is still being used to this day in a much safer and more controlled way. While ECT may sound like a shocking measure to take, before the development of psychotropic medication, doctors did not know how to handle unruly patients. This resulted in a lot of inhumane treatment in the mental institutions. Patients who couldn't be calmed were often put into bed restraints, straitjackets, or even handcuffs. They might also be isolated in a padded room for a long period of time. The asylums continued to grow in population and overcrowd, causing them to be run poorly and leaving people desperate for a solution to mental health disorders. This led to the first lobotomy, which was performed in 1935 by Portuguese neurologist Egas Moniz. Within a year, American neurologist Walter Freeman adopted this practice wholeheartedly and became an advocate for the procedure, performing an estimated 3,000 to 5,000 throughout his career. In 1945, Freeman developed the transorbital lobotomy technique, which consisted of a tool called an orbitoclast and a hammer. An orbitoclast was really just an ice pick that was modified to fit into the patient's eye socket. The lobotomy was performed after a volt of electric shock was used to knock the patient unconscious, and the operation consisted of hammering the ice pick through the patient's eye socket and moving the instrument from side to side in order to separate the frontal lobe from the thalamus. This simplification of the procedure allowed patients the opportunity to have the operation done in a short trip to the doctor's office. Freeman traveled the country performing these lobotomies and would sometimes even do so for an audience. He enjoyed the shock value, but also truly wanted to believe he was curing people. Unfortunately, Freeman never did much follow-up on his patients to see the lobotomy's actual results. It wasn't uncommon for a transorbital lobotomy to leave someone in a vegetative state. It also resulted in nearly 500 deaths, and many people who survived the operation were left mentally incapacitated. Following lobotomy, patients have been described as mentally dull and/or having lost their personality entirely. The procedure reduced many people to childlike behavior and was mainly used to subdue patients and make them easier to handle. It was not a cure so much as a permanent means of restraint. But in the mid-1950s, the drug chlorpromazine with the brand name Thorazine was developed and proved to be highly effective in the treatment of schizophrenia and other mental illness and behavioral disorders. The drug was shown to induce calmness without sedation and have the ability to control agitation and excitement. While there was still controversy over some of the side effects of chlorpromazine, it was generally agreed upon that the side effects of lobotomies were far worse and more common. With the rise of psychiatric drugs and the long-term effects of lobotomy becoming more apparent, the procedure quickly lost support and subsided. The last lobotomy was performed in 1967 by Walter Freeman and resulted in the patient's death. These extreme measures taken to treat patients in the past has cast a horrifying stigma around psychiatric facilities, causing many to be shut down. Unfortunately, this currently results in a large population of chronically psychotic patients ending up homeless or being detained in prisons. Some are also hospitalized in regular medical facilities, but these places do not have access to the full range of proper psychiatric treatment. I personally have spent a few days in the psych ward of a regular hospital, and I can tell you firsthand, it does not have the appropriate resources to treat severe mental illnesses. More outpatient programs and group homes have been developed for those with mental disabilities, but overall, figuring out how to treat and care for the mentally disabled still seems to be a major issue. Hopefully, as we continue to progress and understand mental health, more facilities will be opened with better resources and advanced treatments. In the future, I plan on sharing my personal experience in a hospital psych ward, but for now, I hope you enjoyed this brief history of mental health treatments. I really enjoyed doing the research and making this video, so if there are any other topics that you would be interested in seeing me do this style of video on, please let me know because I really enjoy this and would love to continue making these types of videos. Thank you guys so much for watching, and thank you so much to those of you who have subscribed to my channel. I really appreciate it, and I hope you have a great day.